Determining feeding amounts and frequency. Follow the manufacturer's feeding recommendations. By far the biggest nutritional problem seen in pet dogs is obesity. 2. You should always follow feeding recommendations from the food manufacturer when feeding your dog. This means actually using a measuring cup to measure the correct amount of food on a daily basis. There is usually a recommended feeding allowance on the food can or bag. Follow this advice and limit treats to 1 or 2 a day, and your dog should remain fit. Feed adult dogs 1 to 2 times a day. Adult dogs over a year should be fed 2 times a day. Dogs older than 2 years can be fed once a day. Large breed dogs or dogs with large chests should be fed small meals 2 to 3 times a day to prevent bloat, and never exercised immediately after eating. This can be a serious medical issue for some dogs. Feed puppies more frequently. Puppies younger than 3 months need to be fed their daily allowance split into 3 or 4 feedings. Puppies younger than a year need to be fed 2 to 3 times a day. Alter the amount of food based on your dog's body condition. By watching your dog's body condition, you can gauge if your dog is at its ideal weight or if it needs to lose a few pounds or, more rarely, gain a few pounds. A dog at its ideal weight will have a tuck in its abdomen. Looking from the side, its abdomen will slope up towards its back legs. Looking from the top, it will have a healthy hourglass figure. When you feel the ribs with your hands, you will easily feel each rib through a modest fat covering. Thin dogs will have an extreme tuck, and you will be able to easily feel the ribs. In dogs with short hair, you will be able to see the ribs. If a dog is thin, try adding 10% of its normal food allowance to its daily diet. In overweight or obese dogs, the tuck will disappear and the ribs will be difficult to feel overweight, or nearly impossible to feel obese. If a dog is overweight or obese, take away 10% of its normal food allowance. Check your dog's body condition score again in 4 weeks. If it's still thin or fat, adjust the diet by 10% again. Consult your veterinarian if you have any concerns.